Hey, Harrison.
Hey, Caitlin, it's so good to finally sit down and talk with you. I know you've been busy today. It means a lot. You've taken 2 minutes of your time to come talk with me today. How have you been?
Yeah, I've been good. I'm so sorry that Dr. Jones couldn't come to our little meeting. He just ran into a patient's room, but I do have a few minutes and yeah, we can learn more about what y'all are offering.
That's good. No, yeah, I just want to come by and really hit on our fall prevention program that we have over here at Inhabit. It really starts off with identifying patients that fall under that category. Just out of curiosity, have you seen anybody come in today or yesterday with an assisted device like a walker, or anybody come in that has recently said they fell?
Both of those scenarios actually we see quite often, Harrison. We have a ton of patients that use walkers. We see a lot in our clinic, and actually last week, one of our patients, Miss Jean, she's 98 years old, and she did end up falling, but luckily she didn't break anything. And so her daughter, said that she was fine.
Well, that's good, and she actually would be a perfect candidate for our fall prevention program, even if she didn't break something. We really do a multi-discipline approach to this. We like to send nursing and PT out. We do a fall prevention or home safety evaluation right when we get there at the patient's house. If there's any loose rugs around, we'll get those out of the way. Any cords in the way, we'll get that out of the way. And we use this thing called the Natago exercise program. We get their walking distance within a minute. We get their up and down from sitting within a minute, and we can actually show you outcomes from their progress from any post-fall they've had. How does that
Dr.
sound?
Jones would like that. So you kind of are establishing a baseline, and then we can see how the patient's progressing.
Exactly, and I can come in every couple weeks or every time we do discharge a patient and show you their progress of what has happened. And I know you're busy today. That's really all I wanted to talk about. But do you have any patients in clinic today that might match this topic or this category?
Well, I think that Miss Jean, who we had discussed, she came in last week. I think we start with her. She has devoted insurance, and I think that the daughter doesn't spend every day with her. But I am worried. I'm concerned that maybe she could go back to the hospital. I don't want her to fall again.
Well, perfect. We're just here to bridge that gap between doctor and patient, and also not to get back in that hospital. And I think that's awesome. I think let's start with Miss Jean. If you do like this fall prevention program or like the results you see, I would love to come in weekly and identify some of these patients and continue moving forward that way.
Very good. Well, let me go print the demos for Jean and her information, and we can start with that patient.
Awesome. Well, thank you so much for your time today, Caitlin.
Thank you.